Nursing school is a wild ride, but that doesn't mean you have to run and hide. When the going gets tough, don't leave your stress undiagnosed. You gotta call the nursing student coach. Real life tips from a registered nurse. In school and out, she's seen the worst. Now without further ado, yeah, here is your host. It's the Nursing Student Coach.
Hello, everybody. Welcome to Nursing Student Coach. This is Lauren Chapnick, your host. If you're watching on YouTube, if you could please hit that subscribe button so you don't miss a single episode. Or if you're watching on Spotify, listening on Apple Podcasts, Amazon Music, whatever platform you're listening, if you could take 10 seconds to please pull out your phone, give us a quick rating and a review of one or two sentences of why you like the show. Here's the thing: the more ratings and reviews we have, the more these platforms will present this podcast to prospective listeners who may not have found us otherwise. And ideally, that will help reach more future nurses and help put more great nurses into the world, which is my personal mission in making this show. So thank you so much in your help to do that. I greatly appreciate it. Today, I cannot wait for you to meet our guest. Her name is Pam Dymond, and she is a labor and delivery and mother baby registered nurse. She has been working in the OB maternity world for 7 years, and she's going to tell you all about it. Because here's the thing, guys: nursing school, it's this all encompassing event, this journey, and it's your entire world for a number of years. And then it ends. You pass your NCLEX and you go out into the world. And what's out there is incredible. All these different opportunities, all these different options. And what I would like to do is, with my guests, give you a taste. What is it like to work as a labor and delivery nurse? What is it like to work as a med surg nurse? All these different jobs, all these different opportunities that are out there. We'll explore all of them on this show. And today we're going to be focusing on maternity. And Pam Dymond is our guest. And I'm so excited to bring her on. So here she is. So, Pam, thank you so much for joining us today and welcome to the show.
Thanks for having me. Excited to be here.
Great. I'm so excited to have you. And you have been a maternity, labor and delivery, mother baby nurse for the past 7 years. What got you interested in it initially? What brought you to that world?
So honestly, I didn't know I wanted to do it. When I started nursing school, I really was like leaning towards cardiac back. Like I have a cardiac background. So in my mind, when I went back to nursing school, it was I'm going to do something telemetry, cardiac, something along those lines. But then when I went to my maternity clinical, all of a sudden it was kind of like a light bulb went off in my head. And I was like, oh, okay, like this is interesting. I think I like this, which was really surprising to me. And then we got to do a rotation in labor and delivery. So I got to see births, C-sections and whatnot. And then it kind of like really, really clicked. And I was like, okay, let me kind of rethink my plans here because this is something I could see myself doing. And then when I graduated, I was still really open-minded. I was like, you know what, like I still want that first job. I was just excited to work as a nurse. So I wasn't super picky as to my specialty or what I wanted to do. But then when I did apply to my first job, they offered me to interview for maternity, labor, and delivery. And it was, we'll orient you, we'll teach you all this. And everyone was just super nice. And they were like, we're going to work with you. We'll teach you all this. Cause I was like, I'm like brand new. How am I going to learn labor and delivery, maternity?
It's so intimidating. Yes.
Yeah. But again, I got to speak to other nurses that were doing it, that did the orientation process as well. And they're like, oh my gosh, if you have the passion for this, you have to do this. And then I did get the job offer. And to me, it was kind of like a no-brainer at that point. I was like, you know what? Like, let's just see where this goes. I didn't expect to be interested in it, but I am. So I'll take it and let's see, how this passion grows and where I could go from here, and never look back.
Yeah.
7 years
I
later, I'm
love that
still
story.
doing
That is
it.
a classic example of keeping an open mind during clinicals.
Yes.
I
Yeah.
always say that.
Yes.
Don't close yourself off to anything. You don't know what you're going to
Right.
like. And
Right.
I think if you have tunnel vision, you say, I only want this, and you waste an opportunity, you could be blindsided like you were and just see, wow, there's this whole other world out there that I didn't know. So keep an open mind. You don't know until you're on that floor. And it
Right.
can work the opposite way. I have friends who thought they wanted labor and delivery. They saw a birth and they said, nope,
No, not for me.
no thanks. So it can work in both ways. So what
Yeah.
is it like? What's a typical day like as both on, because you've worked both sides, which is great, both labor
Yeah.
and delivery and mother baby. And what do you like about each versus the other?
Yeah. So when I started, I was primarily in labor and delivery my first year. And then, I would kind of float to mother baby, or we also call it postpartum as needed. Now I primarily just do postpartum. Just where I work now, it was kind of picking one or the other. So
Okay.
I went to postpartum, but yeah, they're very, very different areas. So I always kind of remind my students that too, because, students will tell me, oh, I want to do labor and delivery and maybe postpartum or both or whatnot. And it's very different. I kind of describe labor and delivery to my students, especially kind of like a mini ER for pregnant people, right? Because, it's not just labor that we think we see someone that's 9 months pregnant, contracting and pain, coming to the hospital, have their baby. Labor and delivery sees basically any issue with someone that's pregnant. So it could just be something as simple as a UTI that's untreated and maybe mom needs IV antibiotics. They may do that in labor and delivery. It could be the patient was in a car accident and was cleared in the ER, but now we have to monitor her baby. So many different things. So it's not just the simple, I don't say simple, but not
Right.
just that patient coming to, I'm contracting, I'm going to have my baby. We get a lot of patients sent from their OB offices. So maybe they go for their, 30-week check, 30-week visit in office. And they're like, okay, your blood pressure is a little high. So we're going to send you to labor and delivery for a full workup, ultrasound, blood work, so on and so forth. So it's very, very busy.
Yes.
And kind of
Imagine.
like an ER, you could have a day where, things are kind of going calmly or smoothly. And all of a sudden we say like the bus pulls up and you could have 3 or 4 people 9 centimeters at the same time, and you really don't know what to expect. So you kind of have to have that, I want to say, mentality of be ready for anything, because and like that excitement of it where, that's exciting. I
Yeah.
don't know who's going to walk through the door, what my assignment is going to be, but I'm ready for it and I'm prepared. Where postpartum's a little bit different because we don't really get those surprise people walking through the door. Our patients already had their babies, so we kind of have that, heads up, like someone delivered, so in 2 hours you're going to get this patient and the baby. So postpartum tends to be a little bit less, I want to say, acute in the sense, different populations, different things going on, but we really focus on a ton of education. And I think that's, something that a lot of people don't realize. It's a lot
Right.
of teaching these parents how to care for their newborns. Breastfeeding's huge, how to change, how to swaddle, the mental health aspect of it. We talk a lot about postpartum depression and signs and symptoms to look out for. So it's just very kind of, I want to say, different in that sense, where we're constantly, every time we're in that room, we want to teach them something new and make sure they understand it. And they don't go home feeling like overwhelmed and how do I care for this little person?
Yeah, that's amazing because I know having, especially my first baby, those nurses are everything. You're so
Yeah.
scared, you don't know what to do
Yeah.
with this new life that you brought into the world, and the nurses kind of bring you back down to earth and teach you what you need to know.
That's definitely my favorite part.
Yeah, well, that was my next question is what was your favorite part about labor and delivery, and what's your favorite part of the other side, the postpartum side?
Yeah. So for labor and delivery, it was probably seeing that patient, if you work a 12-hour shift, my favorite would be, having that patient in the morning and kind of laboring with, her, and I always say her family, because it is kind of a team event, and then seeing that birth. So kind of seeing her really work through all that, seeing, like you mentioned, those fears. And, we always know birth, it's the fear of the unknown. Like,
Yes.
if you haven't done it before, like, you have no idea what to expect. So really just, helping support that patient and support the partner and the family, through their doubts. Because, I've had children too. There's always doubts. And I've done labor and delivery where you're like, is this going to happen? Like, is this normal? I'm just kind of helping them work through all that and getting to see, the end result, that baby born. And I'm telling you, out of all the babies and births I've seen, I still will never get tired of the parents' expressions. Like, that's what I look for in that baby's firstborn. Like, mom's expression, partner's expression, like that will never get old to me, because it's just so amazing, even on the craziest days, the craziest shifts.
Yeah. That's so I mean, that's your job. That's amazing. It's such a miracle. I love
Yeah,
that.
it is. And it never
Yeah.
gets, that part never gets, tiring. 3 shifts in a row, crazy hours, crazy days. It's still, kind of centers you and kind of brings you down back to like, why am I doing this? Like, what's, my passion, my reasoning for wanting to do this?
Yeah. And then what about the mother baby side? What's your favorite part there is the educating the new moms and the new parents.
Yeah. So my background is, in education. So I do teach clinical. So hence that kind of naturally became my favorite part, because just like I like to educate my students. I love to educate, my parents as well. I kind of like the challenge of it. So sometimes we'll get like maybe a teen mom or, a mom or patient that has social issues, and just really sitting with them and answering their questions and, helping them work through it and learn, again, a teen mom I had recently was like really doubting herself. Like, can I really do this? And I don't know, I'm young myself, and, kind of helping to guide her and give her that confidence that like, yeah, absolutely. You can learn this. You're going to be an awesome mom. You're already an awesome mom to this baby, because you're wanting to learn, you're wanting to do what's best for them. So just kind of getting to guide them in that sense, and really just building confidence, because again, I worked in postpartum before I had my kids, and I still question myself, when you have your own kids, because it's very different, and it's scary, right? You're like, I have these little people, what do I do with them?
I know. Wow. That teen mom was so lucky to have you. She's gonna remember you, Pam. She's gonna remember you forever,
I hope so. I'll
Just having
definitely remember
those
her.
long, rough nights, she'll remember Pam. That's incredible. So what about the not so glamorous sides? Are there parts of labor and delivery or mother baby that are maybe not so glamorous? Or of course, you probably deal with sadness and
Yeah.
tragedy and loss and things like that. What are some of the darker sides that of the
Yeah.
specialty?
Yeah, I think you brought up a great point right there. So whenever I tell someone I work in L&D or maternity, they're like, oh, wow, like that's so fun. That's such a happy place in a hospital. And I always say, majority of the time it is like,
Right.
definitely, we do have some sad aspects of it. Not every pregnancy maybe is wanted or expected. So you have some kind of, maybe social aspects there helping those patients through. And then unfortunately, not every, pregnancy is viable, or we have stillbirths. And that is something that never, ever gets easier when you're caring for those kinds of patients. And sometimes it absolutely can get to you, because it's just heartbreaking, and it's heartbreaking for that, patient and their family.
Yeah, how do you decompress from that? Like, how do you separate yourself from that? Or what
Yeah.
tactics have you found that work for you?
Yeah, I just think acknowledging kind of the grief. Like, I remember my first stillbirth, I was in orientation, and my preceptor was like, go to the bathroom after this happened. And I was like, I'm like, I don't have to go to the bathroom. Like, what are you talking about? And she's like, no, I want you to go and cry, because I'm going to tell you right now, this is not going to be your first one you're going to see. She's like, you're trying to hold back your emotions. You can't let that build up. I've been a nurse for 30 something years. You can't, keep these emotions inside. I want you to go, take your time, acknowledge how you're feeling, that this is sad, this is horrible, but you can't just kind of push it under the rug and, go to the next patient. And that's something that I did kind of, take her advice on, because, in the moment you're strong for the patient, you're supporting them, you're there for them, but, still like having to see that or go through it, it does take a toll on you. So it's important just to kind of do that check-in with yourself, that self-care, like, am I okay? That was hard to see. And sometimes it's, our colleagues that we'll talk to, my coworkers, I'll be like, oh my gosh, that was so terrible to see, or you saw it, are you okay? How are you doing?
Right.
But not just to, some people are like, oh, it's just part of the job. Like, we just got to move on. And, because
Yeah.
in your head, and it makes a difference.
Yeah, that was really good advice that that nurse gave you, and also to go off to a private place, because it's not the patient's job to console you either. So you
Right.
have to definitely do it privately, but
Right.
to let yourself feel it so it doesn't
Right.
build up. I think that's really amazing advice, and to lean on your colleagues. And
Yeah. It's a
yeah,
team sport, nursing. So if you need that extra support, or just someone to, talk to, and they most likely have gone through it themselves at some point with the patient. So, they're kind of on your side and would understand.
absolutely. So, if there's a nursing student out there that's really thinking they want to work in labor and delivery and maternity, what would your advice be for them, as far as should they? This is a big topic. This is a hot
Yeah.
topic. Should I start out in labor and delivery and go right into it, or should I
Right.
build my foundation in a med surge floor or something like that first? Now,
Sure.
you're a classic example of somebody who just went right into it and is super
Right.
successful and loves it and never looked back. What would your advice be to somebody who is kind of debating what to do?
Yeah, and I feel like that is a debate that you'll hear
Yeah,
with every specialty. And, everyone has such great, different opinions. And that's what's great, that we all, experience things differently. If you truly want to do it, I would say do it. My biggest piece of advice would be to make sure that they will orient you, that they do have like, either like a nurse residency program or something like that geared towards that specialty. So maybe like a bigger hospital versus a smaller community hospital, again, depending on where you live and what area you're looking into, but just making sure that you're getting that training and orientation as a new grad, I think is really key to being successful. So really asking those questions, if you're interviewing, what's the orientation process? If this is just like a 6-week, yeah, we'll put you on postpartum, you'll follow someone, that may not be, a great option, especially for a new grad. But if it's, a program where, okay, we're going to start you a month in basic skills, and you'll be like in the sim lab and learn, the basic things you'll need to learn for a hospital in general. And then we'll take you to the floor and you'll orient, and, you could orient as long as you need to for months if needed, then that would definitely be, I think, a better option.
yeah, I agree. And I think there are so many different residency programs now, and hospitals are trying to compete with each
Yes,
other. And so, no matter what specialty you want to go in, there are residency programs where you can train for 6 months, 9 months before you're even
right,
on your own, before
right.
you're released into the wild. So that's really, really great for those who want to specialize. Because I
Yeah,
think things are changing. It used to be they
you
wouldn't
have to
even
do it.
look at you if
Right.
you didn't have 2 years of med surg experience. Now, it's different. You can kind of step right into a specialty if you want. So, it's nice to
Yeah.
know that that option is there. So, if a new grad, somebody who passed their NCLEX, they're starting a new job soon, what advice would you give them for starting a new job to be prepared to be the most successful that they can be, whether it's on labor and delivery or really any unit? If you
Yeah.
could think back to when you first started, is there anything you would do different in your first weeks and months as a new nurse?
Sure. I would say have confidence in yourself. I feel like I precepted new nurses throughout the years, and they kind of have this mindset, some of them, of like, oh, this is so much. How am I going to do this? And you went through nursing school. Nursing school's intense. You pass your NCLEX. Like, you can do this. Just have that confidence that it's kind of like driving a car, right? Like when you first get your license, you're new, you're like, how do I get on the highway? How do I do this? And as you
Mm,
practice it more, it gets easy, and it's like second nature. You get in a car and you drive now. So it's kind of the same idea. Like, you will get those skills. I think it took me like a good year after, working full time to feel, actually like really confident that like, okay, like I could do this. I'm a postpartum nurse. And even longer to really hone in on those skills. And it takes time. So just know that, be confident and be like, okay, this is, hard for me today, but I'm not going to give up. And the more I practice it, the more I ask questions, it will get easier. And ask those questions. If you're
Mhm.
orienting with someone, ask away. Like, that's what they're there for. They want to help you learn. They want to teach you, but sometimes they can if they don't know that you don't know how to do it, or you're confused
Right.
about something. So never ever be afraid to ask. 'Cause that's really how you're going to learn, and be
Mhm.
open-minded to that.
That's great. I wish you could precept me. That would be great. So, if you teach clinicals, you teach maternity clinicals.
Yeah.
So, are there any common mistakes that you see students making in clinical that you think could be avoided?
I think you kind of brought this up earlier, that there are students that come into maternity clinical and they're either like, I really want to do this, or I have
Mhm.
no interest in it. And I had a student one time basically be very upfront with me from the start and be like, I'm really only here because the school makes us do this. Like, I
Right.
know I don't want to do maternity and I don't want to do labor and delivery. And they're a little bit closed minded. And what was interesting was that when the student did their labor and delivery rotation, they went in for a C-section. And so they got to see the OR, the role of the scrub nurse, the circulating nurse, all that. And the student, when we were post-conferencing, they go to me, they're like, I want to do the OR. That was amazing. Like, and
Yep.
this person actually is an OR nurse now. And I just kind of
Wow.
laugh because this was the person that was very kind of closed-minded to this clinical, that was like, not that they
Yep.
were negative. They're just like, I know I don't want to do this. So
Right.
I guess my
They
biggest
thought they
suggestion is,
didn't.
yeah, like, just be open-minded to stuff. I mean, again, like, we all have our areas that we're kind of like, I probably won't end up doing this in my career, but be open-minded to the experience, because you really don't know what you're going to see. I mean, it's really open. Maybe you'll follow this person to interventional radiology, your patient. Maybe you'll follow them to ultrasound. You'll get to kind of see different areas that, again, may kind of click, and you may be like, wow, that was interesting.
Totally. It's such a common theme and you hear it all the time. I didn't expect to like this. I didn't think I would
Right.
like this. And the OR story is a perfect example of that. And I know the day that I got to go into the OR to see that emergency C-section of twins, it was
Yeah.
totally unexpected. It just that's how it goes. It just kind of happens. And I was
Right.
standing right there. Go, scrub
Just
in,
go
go.
now.
And it
Right.
was awesome. And I personally would not want to work full time in the OR. I like that patient interaction.
Right.
But
Same.
yeah, but it was amazing. And I can see how somebody could be pulled into something like that and just have, just be blindsided, just have a 180 of this is actually what I want to do. So if you're closed off and you don't even get those opportunities, you're really missing out, is what I
Right.
think.
Right. And how would you know unless you tried it? Right.
Exactly. Exactly. Well, Pam, thank you so much. This was such a great conversation. And just to give our listeners a little insight as to what does the world of labor and delivery and mother baby look like, because I know it's a popular one. A lot of nursing
Yeah.
students think that they want to do it, and so I know that this will help them in answering some of their questions. So thank you so much. And
Oh, thank
if you
you.
want to connect with Pam, she is on LinkedIn. So I'll put that information in the description of the show. And Pam, thanks so much. Have a great rest of your day. Give your
You
kids big
too.
hugs and have a great semester.
Thank you. Thanks for having me.
Absolutely. Okay. Bye bye.
Take care. Bye.
Well, that's going to do it for today. Pam, thank you so much. That was so great to speak to you. And for everybody watching, it is my personal mission to help put more great nurses into the world. Thank you so much in helping me to do that. Go to nursingstudentcoach.com, subscribe to our mailing list to get all the latest updates of the exciting things to come. Until next time, this is Nurse Lauren. Have an amazing day. Bye bye.
Thank Thanks for tuning in to the Nursing Student Coach Podcast.